Trying to help the weight loss patient can be very challenging. Weight gain, of course, is a complex issue, and weight loss is even more complex. Weight loss efforts all too often give temporary results, which lead to the dreaded plateau, and then like gravity, the weight comes back on. Let's look at some of the factors involved in weight gain and weight loss. Body mass index. Body mass index is the estimate that is used to determine your risk for disease and how much body fat you're carrying. The higher your BMI or body mass index, the higher your risk for certain diseases such as heart disease, high blood pressure, type 2 diabetes, gallstones, breathing problems, and certain cancers. Body mass index is a simple calculation using a person's height and weight. The metric formula is BMI equals weight in kilograms divided by height in meters squared. The standard formula is BMI is weight in pounds divided by height in inches squared multiplied by a factor of 703. So if you haven't already done that after the webinar, you can go ahead and check your own if you wish. This presentation that you're looking at now should have been sent to you, and you can just download it and you'll have the written materials. Hey, BMI for women below 18.5 is underweight. 18.5 to 24.9 is healthy. 25 to 29.9 is overweight, and 30.0 and above is obese. For bed, the number is below 1.85 is underweight. 18.85 to 24.9 healthy, 25 to 25.9 is overweight, and above that is obese. So the CDC listed 5 main causes of overweight. You have your behavioral causes, community environment, genetics, diseases, hormonal disorders, and drugs like steroids and antidepressant medications are well known for their weight gain side effect. Let's take a close look at some of the behavioral issues. Behavioral issues are on a gradient scale from sort of a minor issue to such a major issue that it's considered to be a disease. Anorexia is the first one. And anorexia, people with anorexia may limit their food intake or compensate for it with various purging behaviors. They have an intense fear of gaining weight, even when they're severely underweight. So probably a lot of patients that you see, they may be not anorexic, but they do have a fear of gaining weight, and it's on their mind. People with bulimia tend to eat large amounts of food in a short period of time, and then they purge. They fear gaining weight despite being at a normal weight. Let's take a little closer at that. The history of eating disorders is quite old. In ancient Rome, people used to vomit up food they ate in the period of feasting. They even had a special place for it called a vomitorium, if you can believe that. And the emperors Claudius and Valerius were known to be bulimic. The ancient Egyptians purged themselves every month for 3 days using emecs and enemas to preserve their health. So 1, they're trying to vomit up the food, and then 2, they're trying to purge out through the rectum. They thought that human disease came from food. In ancient Egypt and Arabia, there are also descriptions of text of binging, descriptions in text of binging and purging. So it's fair to say that people should be a little concerned about their weight. The CDC lists 5 main health consequences. There's an increase of all causes of death. That means no matter what the cause of death, obesity seems to be in there. High blood pressure, it causes high blood pressure, and so that's a cause of death. The high lipids and cholesterols, type 2 diabetes, and coronary heart disease are all consequences of obesity. And lower levels of overweight push you in that direction. Additionally, the CDC listed 4 more items here. certain cancers, a lower quality of life, depression, anxiety, mental disorders, body pain, and difficulty with physical functioning. Okay. Also, unfortunately, stroke is a consequence of obesity, gallbladder disease, which I'm sure you see a lot of in your patients, and osteoarthritis, sleep apnea, and breathing problems also. While we're on this page, I do want to talk to you briefly about gallbladder disease. Gallbladder, is quite an issue for a lot of people. They usually start with small attacks and they get bigger. When the attack gets bad enough, they go to the emergency room where it's diagnosed. And this is a surgery that's usually scheduled. It's not usually an emergency surgery. And gallbladder patients often end up in the nutritionist or the chiropractor's office looking for relief because they don't want to do the surgery. They think maybe there might be a problem with it, and they're hoping you can help them. There's actually an awful lot that you can do about that. And I'm thinking that our next webinar will focus on gallbladder pain, and how to address that. If you have any subjects that you want us to address in future webinars, or if there's one that you're just dying to address and it should come in the next webinar, just put it in the chat box right now or anytime during the webinar, and I'll do what I can to accommodate you and your patients. What are the medical treatments for obesity? Weight loss medications, psychiatric medications, gastric banding, gastric bypass, and the gastric sleeve. These, if you have any familiarity with these, you know that these are torturous treatments. The gastric bypass, the gastric sleeve, the gastric banding. You couldn't do that to a prisoner of war. Those are illegal according to the Geneva Convention for prisoners of war. It's considered cruel and torturous treatment. But people will voluntarily go and pay to have this treatment done. It's just a sign of how desperate they are to lose the weight. And of course, these are false treatments because they don't get to the underlying basis of the problem. And if they temporarily lose weight, soon weight gain comes back, maybe not the full amount. And from that day forward, they're subject to almost unstoppable nutritional deficiencies, which brings the cascade of health problems associated with nutritional deficiencies. Psychiatric medications, well, I don't have to talk more about that. Just read the label for the warnings and the cautions and the contraindications. That is a disaster. Weight loss medications, most of those are completely disreputable. By this time, they've lost all their good reputation because of the large amount of side effects and the low effect. So you figure this is a natural for a nutrition practice, but I have to tell you, for the first 5 years of my nutrition practice, I refused to accept any weight loss patients. I got to tell you, it was just too complicated an issue. It was too problematic. The patients, I didn't want to lose with them. I didn't want to give them false hope. And I certainly didn't want to bear the stress of treating patients who didn't get better. And these are desperate people. And so I felt it was best just to avoid the issue. There are plenty of other issues that I can handle, plenty of other patients with what I consider to be serious problems, and not just cosmetic, which was my thought at the time. And so I focused on them. Well, after about 5 years and constant bombardment by people wanting to be helped with it, I settled down to say, well, what can I do to create a program that will produce predictable results? Well, obviously as predictable as anything with dealing with humans. But what can I do where my patient is going to have an 80% chance of coming out of this, better than they came in? And I got to tell you, with most weight loss programs, their chances are much less than 80% for coming out happy once you take a look at the 12-month stand they have. So I created this program, years of, I hate to say trial and error, but there certainly was a lot of trial and error. I had my share of errors. I had my share of, losses. Thankfully, my patients understood that I was doing the best I could for them. and they were a little in apathy about losing weight anyhow. But finally, I was able to hit a program that actually worked and produces predictable results, and I'm going to share that with you now. This program is available to you and your patients in this little handout, which I've provided for you. I'll go through this handout with you. It's so easy. You can just print it or email it to your patient and send them on the road to health. So this is the top of it. When the patient clicks right over here, that'll take them to the video that you're going to see later on, showing them how to do the acupuncture points. Now, over here, you can see is my website. But for those of you that are on the webinar right now, I would be happy to create a personalized or customized brochure for your practice. We'll take out my logo, we'll put in your name, your website, your practice information, phone number, address, your website. I'll put a clickable link, so they'll click that online, and that'll bring them right to your website. So yes, you're going to be sending them to this, but I'm going to be sending them right back to you, because they're going to need professional guidance to get them through this minefield of weight loss. So just contact me, email me, let me know, and I'd be super happy to create that for you. This is only for people who are actually on the webinar. Everybody else, they get the brochure anyhow, but customization, that's for you. Okay, so because these are acupuncture points, people have to know certain things about anatomy, anterior, posterior, how to measure things. It's all covered in here. These are the weight loss points. I'm going to cover those in detail. These are the weight loss supplements. I'm going to cover those in detail. You can see I start with the standard process program. This is the medical disclaimer. So you did get a sample of this in your handout in your email. So let's take a look at the program. Standard process 21-day purification. This program has so much to recommend it. One, who knows what the person's diet is? And are you going to try now to take a patient on this diet that maybe they love, or maybe they don't, or maybe they hate, and try to mess with this? No, I like to reboot the system. Reboot the system. Reboot the system with a standard process cleanse. Boom. In 21 days, pop them out of all their old healing habits. Pop them in to a beginning of weight loss. Give them fast results where they're going to lose some weight, and more importantly, they're going to feel better and hope they're losing weight. I won't go to the details about the cleanse. I use the exact cleanse, in the standard process booklet, exactly as designed by standard process. This cleanse has been used by probably hundreds of thousands of people. You don't mess with it. I don't mess with it. Just give it to them. Boom. It's just too easy to do, and it gives them a clean slate to start. When the cleanse is over, you bring them back in. And I tell them, if you complete the cleanse before you see me your next visit, stay on the cleanse diet until you see me. Don't make any changes. When they come back to me, I then put them on intermittent fasting plus a keto diet or a Mediterranean diet or a paleo diet. According to what I found in my experience in my clinic, these are the diets, and this is the program that'll do it. Intermittent fasting is super important because it gets you into the deep fat loss, as opposed to just losing the same 10 pounds and regaining it every time. This gets past that into the deep fat loss. We can do a whole program on intermittent fasting if you just put it in the chat, but I'm not going to cover that now. Okay, so the first product is Pitutrophene, PMG, 2 twice a day on an empty stomach. According to Dr. Royal Lee, the central regulator of tissue permeability is the posterior pituitary gland. A daily dosage of 1/100th of a grain, that's 0.00065 of a gram, will reduce osmotic assimilation through the intestinal wall of nutrients and cause a loss of appetite with a few days. So you have your patient, start them on the Pitutrophene, and before 5 days are out, their hunger cravings will have definitely been reduced. This is completely aside from the intermittent fasting, from the keto diet. This is it's a home run product that almost stands by itself. but weight loss doesn't let anything stand by itself. It's one more powerful weapon that we have. It's like firing a mortar round. Okay, Colaco, 2-3 times a day, supports digestion, source of bile salt, source of gallbladder function, supports healthy elimination, and supports sleep. You will not see this on the literature anywhere, but I got to tell you, it supports sleep. Colaco triggers the release of cholecystokinin. Cholecystokinin begins the process of fat digestion. I'm not going to go into all the details about it, but it's also the happy hormone. And when people have cholecystokinin release, they just feel happy. And when I have trouble sleeping or I wake up in the middle of the night, I take 2 or 3 of these things with a little bit of water, and I go back to sleep, and I sleep like a baby. I'll tell you, it's something you got to try if you have a little sleep loss. Okay, Cataplex G, twice a day, provides a calmative effect on the nervous system, encourages healthy parasympathetic nervous system function. That means it turns off the sympathetic, the fight or flight, supports healthy liver function. That means it helps reduce the fatty liver, supports central nervous system function, provides coenzymes and cofactors, and provides brain extract, liver extract, stomach extract, nutritional yeast. It basically acts to calm the body by opening the vessels of the blood, allowing nutrients to flow into the tissues. Okay, beta food 3 times a day contains beets, which support digestion, provides a methyl donor for liver detoxification, contains betaine, which is great for liver and cardiovascular health, and supports the normal processing of dietary fats, and it's fats that make you full. So if you eat fats, you feel full, but if you digest fats, you really can feel full. Also consider, so that's the basic program, no more, no less. Also consider 1 SP Complete shake per day. So if people like shakes, this is the product for them. It's whole food, nutritional, I call it insurance, because it gets everything they need. So no matter how off their diet is, if they have a shake a day, boom, they know they're getting the nutrition they need. If they don't like shakes, just pass by. Next product is choline. Choline supports healthy fat metabolism, especially good for those on a high-fat diet who have trouble tolerating fats. Read keto diet. Okay, Coleus forte promotes healthy digestion. It's traditionally used to support cardiovascular health, support skin and respiratory tract health, support occasional sleeplessness. It is an herbal product, so you need to take a look at the cautions and contraindications. Thyroid Complex. Well, if a person has any thyroid issues, then Thyroid Complex is the product for them. That supports healthy thyroid function, helps maintain and improve general well-being, but it's primarily for those who have hypo or hyperthyroid. All right, so let's take a look now at the video that shows you how you and your patients how to find and activate these acupuncture points.
Hello. In this video, I'm going to show you how to use 3 acupuncture points to help you reach your weight loss goals. Acupuncturists believe that acupuncture can stimulate the flow of life force, which they call qi, to increase metabolism, reduce appetite, and lower stress. A recent analysis of 21 studies with over 1,300 participants showed that acupoint stimulation was significantly more effective than diet and exercise for reducing body weight and body mass index. We do know that achieving and maintaining a healthy weight is a complex process involving many factors such as the endocrine system, the immune system, the nervous system, the gastrointestinal tract, and genetics, to name a few. Because acupuncture points affect multi-systems, acupoint therapy is perfectly suited to help people achieve their weight loss goals. My name is Dr. Baritz. I'm a chiropractor, nutritionist, herbalist, and I'm certified in acupoint physical medicine. I've helped thousands of people live better naturally, and I want to help you too. If you have a condition that you would like to address, please note it below so I can create a video for you. If you like this information, please give me a thumbs up, subscribe, and hit the bell icon to be alerted to new videos as they come out. In my experience, combining acupoint stimulation with a healthy diet and exercise program gives best long-term results. The 3 points for weight loss are Heart 3, Governing Vessel 26, and the Appetite Control Point at the front of the ear. Let's take a look at how to find and stimulate these points. Governing Vessel 26 is in the groove that runs from the base of your nose to your upper lip. The name for this groove is the philtrum. In addition to helping with weight management, Governing Vessel 26 is said to restore clarity, open the senses, quiet the nervous system, and relieve low back pain. To find Governing Vessel 26, press into your philtrum, the center of your philtrum, and press slightly up or slightly down until you find a tender spot. Stimulate Governing Vessel 26 by rubbing or pressing 5 times rapidly. Then take a break for a count of 5, and then repeat 4 more times. The skin in your face can be tender, so be sure not to use too much pressure. The next point is Heart 3. Heart 3 is located on the inside of your arm, halfway between the tip of your elbow and the elbow crease. In addition to helping with weight loss, Heart 3 is said to calm the heart, pacify the spirit, help restore memory, improve arm range of motion, and reduce trembling of the hands. To locate Heart 3, find the midpoint between the tip of your elbow and the crease of your arm, right about over here. Then press in till you find a tender spot. Stimulate Heart 3 by rubbing or pressing 5 times rapidly. Then take a break for a count of 5 and repeat 4 more times. Now find Heart 3 on your left arm and repeat. After you're through, relax, take a deep breath, and move your arms around for a minute or so. Things might be looking a little brighter or sharper to you, and your joints might feel more flexible. This is normal and expected. Repeated treatments deepen results. Heart 3 has also been used to reduce toothaches, headaches, and dizziness. The final acupuncture point for weight management is the appetite control point located just in front of the ear where the tragus meets your face. The tragus is this little section of the ear that protects the ear canal. The appetite control point is said to relieve hunger and reduce compulsive eating. To determine which ear to treat, press on your left nostril and breathe in and out. Then press on your right nostril and breathe in and out. Notice which side does not breathe as easy and treat the ear on that side. The breath test may change from time to time, so it is best to check each time you want to stimulate ear acupoints. Very occasionally, you might find that both nostrils breathe the same. In that case, stimulate the point on both ears. Now gently press just in front of your tragus and find a point that is tender, sensitive, or painful. Gently stimulate the appetite control point by rubbing and pressing 5 times rapidly. Take a break for a count of 5 and repeat 4 more times. During or shortly after stimulating these acupuncture points, you may feel heat, energy, or a full sensation in your abdomen. This is normal and may continue for several hours. I suggest that you respect the rhythms of your body and hold off eating until you're truly hungry. Good luck with your weight loss goals.
Okay, well, so that is the video that your patients will see if they click on that link. Now, any questions that I can answer?
It looks like all the questions are in the chat. Do you want me to read?
Let me, actually, if you wouldn't mind reading them, that wouldn't be a bad idea.
Sure. So the first one says, would love the gallbladder topic. That's just kind of a comment.
Yep.
Gallbladder and liver would be great. Gallbladder as well as kidney stones would be a great topic.
Oh, good.
And then there was one question here. How many times a day do you do the acupressure points?
Good question. We would start with 3 times a day for for 30 days, and then you can go down to twice a day and then once a day, according to how they do. You know, this acupressure is really kind of amazing. And the more you do it, the less you have to do it. So oftentimes we'll start the patient a lot. It just seems to open up these channels, and then it just needs less work because it's bringing the body back to where it's supposed to be or where it can be, not trying to overlay and put something, you know, new. It's really different than, say, like medications, which are trying to force the body to some, you know, pattern. It basically just lets the body fall back into its normal pattern.
Great. Couple more here. Is there any reason not to do both ear points?
I don't know any reason not to do both ear points, but and there's some debate, there's professional debate on this, but it does seem to be that if you do the one ear point, that's where you're going to get best results. So maybe you're going to do the other one. And anyhow, if you want best results, I would suggest just do the main ear point. There's no problem. You want to do the other one, it won't stop the results. It just might not be quite as good.
Okay.
I haven't done independent research on that.
Then someone asked, how do you feel about ear seeds and auricular therapy?
Auricular therapy, sure. So auricular just means the outside portion of the ear, for those of you. So ear seeds are a great idea, as long as you place them right. It's really just another module, another way of doing it. I don't really recommend the magnetic seeds, because that is a very sophisticated approach. Unless you're a trained acupuncturist, you can actually send a person doing it the wrong way if you do the magnets, you put the magnets on. But ear seeds are fine. I do want to mention something else. The auricular therapy is super powerful because, you know, a lot of this works with the nervous system, and energy travels on the nervous system 12 feet per second. That's the speed. So if it takes less than a second, if someone stubbed your toe, it takes less than a second to get to your brain, but it still takes a certain period of time. But when you're touching a cranial, when you're addressing the cranial nerves, which you're doing, you know, with the ear acupuncture, it goes in very, very quickly into the nervous system. And those are some of the most powerful points. We don't necessarily send the patient home doing a lot of those because they may have trouble finding them. But if you're, if you're willing to, learn a little bit and use those in the office, you'll really be helping your patients.
That's great. Does anyone have any other questions? I think that's everything. Then someone said, would you do stomach points also?
For weight loss or for another subject?
They didn't say.
Well, I do a lot of stomach.
Yes, weight loss.
Weight loss. This protocol works really, really good. You certainly can do more. Of course you can. You may do 40 in your professional practice. You might do 40 points. But when you send the patient home, you want to make it very simple for them because compliance is an issue. But if you know enough about acupuncture to do stomach points, I say go for it. The more the merrier when it comes to acupuncture. Great.
And lots of thank yous, and I'll put a little quick shout out. Lewis and I are doing A to Z on Thursday. That's free for anybody, everyone. We're going to talk about GI Adsorb, the brand new Colaco 2 product. And thank you, Dr. Baritz. Thank you so much. This is fantastic.
Great. Thanks so much. Great to be with you. Have a great night, everybody.
Thank you.